Nehal, Angana, Natalie, and Nina, and today we will be talking about our project Health Connect. Health Connect originated from the concepts of social determinants of health to create equitable health systems and communities. We see social determinant-based solutions as a way to move communities from underutilized space and disconnected community health services to engaged and connected ecosystems for equitable health access. We acknowledge that the most impactful solutions are socioeconomic, but it is difficult to fully address this within our scope for this class. We will be focusing on the other elements of the pyramid to help make addressing socioeconomic concerns easier. As we will explain further, Health Connect operates at different scales of the design continuum through physical and digital interventions, and these interventions allow communities to engage at many points along the experience continuum. The interventions we have developed are scalable across contexts and infrastructure needs. Our different intervention scales are meant to increase access to healthcare services based on community need and to make use of underutilized public spaces for community health. The extent of our interventions respond directly to the needs and existing healthcare infrastructure within a particular community. Based on the findings of this research from GoodRx, we referenced precedent communities with low, middle, and high levels of healthcare deserts. To develop an intervention for a low-level healthcare desert, we studied Wayne County. We classified a low-level healthcare desert as a community with more established healthcare infrastructure. For example, there may be ample hospitals, but the relationship between these health systems and their community may be poor, resulting in less community utilization. Later in this presentation, we will focus on Detroit, a city within Wayne County, to explore how Health Connect would work for this type of context. For a medium healthcare desert intervention, we studied Livingston County. We classified a medium-level healthcare desert as a community with some healthcare infrastructure, but not enough to meet the local needs. For example, while there may be hospitals or clinics present within the community, access may be limited for some due to clinic hours, transportation concerns, or financial constraints. The highest level of healthcare desert has the highest need for intervention in their infrastructure, which may be practically non-existent. For our purposes, we studied Clare County. In a community with high healthcare need, residents may be required to drive long distances to neighboring cities to receive care. Because of extended travel distances, sick residents may forego care until their condition becomes very serious, straining emergency services and creating poor outcomes for patients. To address the healthcare desert scenarios we identified in our research, we developed a series of physical interventions. Our 3 physical elements are augmented by our digital intervention, an app that we've developed. Each physical intervention is equipped with a Wi-Fi hotspot, which can work in tandem with the app and encourage more interaction with Health Connect. Now we will walk through each intervention in more detail. Our smallest scale physical intervention makes use of space where people already wait in their daily lives and turns waiting time into a healthcare opportunity. Kiosks will be installed in natural waiting areas like grocery stores, laundromats, or bus stops. These kiosks will allow people to schedule appointments, update their health information, or chat with providers. This is most appropriate for low-level deserts to create connections between existing healthcare infrastructures. As we scale up in physicality and healthcare need, we move to our mobile intervention. These clinics take primary care to areas of highest need and provide care across various health disciplines, from vaccination stations to pediatric pop-ups. Services would not necessarily be limited to medical needs, as these interventions could host classes on insurance and technology literacy. This would be most appropriate for medium-level deserts to fill in gaps in communities with less substantial healthcare infrastructure. Our final intervention is for communities with the highest level of healthcare need. For these communities, established infrastructure is either poor or non-existent, and our intervention would involve construction of new clinics. This new built infrastructure would be sited in a location with high local utilization to eliminate any access issues. For example, a clinic could be sited near a school to provide care for sick children and make access easier for parents if they also need to see a doctor. The digital element of our healthcare ecosystem is WebWell by Health Connect. This mobile app supports our physical interventions and promotes healthy and connected lifestyles for its users. Elements of the app address its 3 guiding principles: health behaviors, social connection, and environmental health. For example, badges, points, and check-ins foster better health behaviors, while local events and digital buddies encourage social connectivity beyond the digital sphere. To further the environmental health of the community, geolocations are leveraged to notify users of Health Connect's physical intervention locations. Come with us now to follow Pablo Sr. through his day as he interacts with both the physical and digital aspects of Health Connect.
To start his day, Mr. Ortiz checks his dashboard for his daily reminders. These help him remember to take his medication and inform him of upcoming events he's shown interest in. For each event or activity, he can gain HP, or health points. If Mr. Ortiz looks at his events and sees that his local farmers market is listed, he decides to head up catch the bus to the market. While at the bus stop, Mr. Ortiz checks in with his digital buddy, his grandson, using the Wi-Fi built into Health Connect's bus stop kiosk. He loves that he can use his idle time to connect with his grandson and knows that his grandson can also be checking in on him, especially on days he forgets to take his medication. While shopping, Mr. Ortiz's phone buzzes and he sees that WebWell is notifying him about a pop-up clinic at his farmer's market. He stops by the pop-up clinic to get his knee checked. It's been hurting recently, but he hasn't been able to get in to see his doctor. As he's heading back to the bus, Mr. Ortiz sees that he's earned 5 health points for attending the pop-up. Earning these points makes him want to earn more, and he can do just that by continuing similar health-promoting behaviors. Back at home, Mr. Ortiz sees that he can redeem his newly earned points for a local event. He loves how he can increase his community connection by caring for his health. To finish his day, Mr. Ortiz does his daily check-in. He feels connected to his community and happy that he was able to do something small for his health today. Thank you for coming with us on this journey.
Ultimately, we aim for our physical and digital interventions to work together to promote healthy and connected communities. Health Connect will provide increased access to resources with a firm grounding in addressing the social determinants of health. We seek to leverage these social determinants to empower each individual in the community to take an active role in making healthier choices. By establishing a hub of services designed to meet the current and future needs of the community, this initiative will create positive, lasting change in the health outcomes of underserved populations. Thank you for your attention. We can now take any questions or comments that you may have.